Hello again. The second chapter we're going to cover is chapter 29 in Parampain. That's related to vital signs as measures that will tell us how the patient is perfusion, but they'll tell us many things more. Many concepts are revealed, alterations in those, alteration in oxygenation is shown in vital signs alteration and perfusion, and so many other things we can talk about as we progress in the course we're taking now and another courses throughout the program. But and I know that in the lab you are doing the hands-on of those vital signs. So please try to tie things together and think about and reflect about what you are doing and why you're doing it. So in every chapter, every learning activity we do, there are objectives. So in this first, in this chapter, first and foremost, we have to think, okay, why are we looking at checking temperature? So what concept is behind temperature? It's thermoregulation. There is a whole mechanism of thermoregulation in the body. What is the center that regulates thermoregulation? What if that center is affected? Is the temperature gonna be really revealing of a patient that has a fever? If the center where the regulation is, the temperature is regulated, is out of function? Think about this and let's talk about it in class. And then if the patient is hypothermic, that means the temperature is low, or hyperthermic, what measures as a nurse I can do? And what is the fever telling me? All these are things you have to think of beyond the fact that you're just checking the temperature. That's one example of the vital signs, and every other vital sign has all these questions tied to that measurement. So first and foremost, I'm going to discuss this coming slide with you, and whose responsibility is to check vital signs? It is our responsibility as an RN. Okay, but we see it all the time that nurse assistant do it. But should we stop and reflect on that? Is there am I saying things that contraindicate? I'm telling you it's your responsibility, yet on every unit you see that the nurse assistant collect those vital signs and doesn't even most of the time tell anybody, just plug them in the computer. We're going to discuss that, and we're going to tell me how does that work, what is the concept behind it's our responsibility. So then how do we choose the equipment to check temperature? Is there a difference between one that we are using for the tympanic, one that we're using for the forehead, when we're using oral versus rectal? Does any one of them pose any risk? Can we standardize them and say if my temperature oral is 37.4 or 98.4, is it the same as my core temperature? These are things you have to think about. And then you have to think also about is anything affecting why the temperature is like that? So that example in your PowerPoint that you must have read of, like a patient drinking a hot bowl of soup, or me drinking a cup of water, and you come and check my temperature. Does it affect really the temperature? Have you seen it in reality? Ask someone and come prepared to tell me that those findings. And then we're going to discuss one thing, and you're going to tell me when you're coming in to check the vital signs of the patient, what you say before, what you say after. And then, okay, so here we're looking at this patient, and we want to know what things we are going to think of when it comes to vital signs. We're thinking this is a 26-year-old, you know, she's of South American background. She's a smoker. She's overweight, 20 pounds overweight. She smoked since she's 16. Are these going to affect her vital signs? Think about this, and we'll discuss that. So body temperature, this is what your Para and Peri say the normal temperature is, and the hypothermia is somewhere around this, and hyperthermia somewhere around that. Don't get confused because see here, pyrexia is considered anything above 100.4, and the hypothermia is considered anything less than 36 or 96.8. But so the image may be confusing. Just remember those. You're gonna see these numbers in every book, and mostly these are the numbers that I use. Don't look at those grids that are there. Look at the numbers that are shaded in orange. 96.8 to 100.4 is the average normal range of temperature. That's 36 degrees Celsius to 38 degrees Celsius. And then we have to know what vascular control those temperature. What is the heat loss? What is heat production? Where do we have heat production? Do we have a factory in our body? And does the skin play a role in temperature? Is there a center in the body? Where is that located at? That's refreshing your physiology knowledge that you bring forward to this course. And then so we're going to skip this and talk about our vital signs. So what does affect temperature? So you need to know all those variables that affect the temperature. And voila, they're telling you that the hypothalamus is the center in the brain that controls temperature regulation. And these are some of the mechanisms for altering or trying to regulate the temperature in the body. The PowerPoints go in the nursing process style. You have not been introduced to nursing process. I'm just gonna run through it very quickly. In the nursing process, there are 5 stages, which are the stages you do in every day. We're gonna talk about them more elaborately when we get to the nursing process lecture. But first and foremost, assessment is the first step you do. Whenever you want to do anything, you look around, you collect data, you look for cues. That's what assessment is. Call it whatever. It's that time when you're gathering data. So that's the assessment. So that's you checking the temperature, that's assessment. And then the next stage, after you assess and collect the data, you say, I know that's what's happening. So that's you thinking of the diagnosis. So we say, okay, patient is having high temperature, so that is hyperthermia or fever. So we will move on. Once we decide this is the problem, what are we gonna do about it? So the next step is planning. What is my goal for this patient? My patient is hyperthermic or hypothermic. My goal is for the patient is to have a temperature within defined limits, to have optimum level of functioning. So this is where you do. And how soon do you want this? You always have to have a goal. I want the temperature to be controlled within 30 minutes. Within my shift, I don't want the patient to have any spike in temperature without me controlling. So how am I going to do that? What does the teamwork and collaboration have to do with it? Okay, if I'm decided that I'm going to put some washcloth cold rags on the head of the patient, is that going to be enough? What if the patient needs some Tylenol? Can I, because at home I can pick up the Tylenol and take it, can I give the patient Tylenol? Okay, they tell you no. How can I get an order for Tylenol? You call the provider. How do you call the provider? Use the proper communication. So you use the S-bar mechanism. First, you check in the chart of the patient, see if there is an order. If there is no order, you go and call. And when you call for an order for the medication, you're going to learn when you talk about medication as you advance in this course, that you need to have a specific dose, specific time, specific route, and all those 6 rights of the drug has to be in the order for you to really go and do what the provider told you. So then when you implement, you do what you said you're gonna do. You plan these, you go ahead and implement them, and always, after we do everything, We sit back and reflect and look and say, did it work? So the last stage is the evaluation. What has come about? What was my expected outcome, and did I achieve it? And you'd say, was met or not met? Anytime you say it was not met, you have to have an action plan. What is my next step? What am I going to alter with the initial plan so that I can achieve those outcomes that I wanted to achieve? So then we move on to the next vital signs, and that is checking the pulse. Checking the pulse, we're checking the heart, how much it's pumping, and our goal for the pulse to be throbbing, good pulse, where we can feel it. It's not faint, it's not too pounding, it's just right. It's like 2+, you'll see them 0 to 4 or 3+, and then how much it is pulsating per minute. That's the heart rate. And then per minute, if it's pulsating 60, that's within normal. It's the lowest normal, but it's normal. It's pulsating 100 per minute, 100 beats, boom, 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 boom. And then 100 is okay. What if it's higher? What does it mean when the heart rate is higher than 100? Or the pulse rate is higher than 100? What does it mean when it's 50, for example? What factors affect the heart rate, the mechanical, the neural, the chemical factors? Where is the rate controlled in the heart? Remember the sinoatrial node, the SA node? Please review it, and I want you to tell me a little bit about it when we meet in lecture. So the first part of the nursing process when it comes to pulse checking is the assessment. Again, when we assess the pulse, we have to have those equipment, same like when we got the thermometer to check the temperature. We need a stethoscope. We need our hands to check the pulse, the stethoscope to check the apical heart rate. You need to understand, what does the stethoscope do? How does it transmit the heart rate? Is it accurate? Can I trust what I'm hearing? All these, you're having those hands-on experiences in your health assessment and in your lab classroom. So make use of those to master this skill that you're going to be doing every single day of your profession as a nurse. And then when we talk about a pulse, you heard rate, rhythm, strength, equality. I want you to explain those 4 terms for me. As a layperson, you're telling this to me. What does it mean? What you're looking when you're looking at those? And then you find something abnormal in the pulse. What are some of the nursing diagnoses? How does activity intolerance tie into a pulse? How does dehydration tie into a pulse? So you're going to tell me some of those. What do you think of those 2 nursing diagnoses or problems that you're seeing with alteration in the pulse? And again, every time you have a problem, identify problem, you put a plan, how do you solve this problem? Some actions are independent, you do them, you don't need anybody to tell you what to do. And some things are based on collaboration with other team members, and you need an order to do. We'll discuss this. Tell me, what can you do independently? What things you have to ask somebody for an order to do? And always, you have to sit back, reflect, and see what worked, what didn't work, what's my action plan, how I'm going to do it differently. And again, respirations, what do they, how do they physiologically happen? What controls respiration? Is there a center in the brain that controls respiration? Okay, what happens if that center is down? Okay, if that center is functioning fine, why is the patient breathing fast? Why is the patient breathing slower? What factors affect that? What are the parts of the respiratory system that control how deep we breathe, how we don't breathe? Can it be that the person is having no problems with all those, and yet they stop breathing? I want to explore that with you tomorrow. And then again, with the nursing process, with the assessment of breathing? Are we only assessing how fast a patient is breathing? What does ventilatory depth and rhythm mean? And what does pulse ox has to do with ventilation? And what does capnography mean? If you don't know these terms, look them up, medical terminology, just know how to decipher them. And again, you're having diagnosis, and under these, you're going to have some things like activity intolerance. Why would a patient with irregular respiration having activity intolerance? We have to explore that in classroom and understand it's not just you listening to me talking. You have a plan, you implement it. What's part of the implementation? What things you can do on your own? What things you need and doctor's order for? And then you evaluate, you always independently evaluate what you're doing and see what's working, what's not working, how can we make that work better. And blood pressure, again, what are some of the elements that affect the blood pressure? We're still tying this into perfusion. Remember, I asked you to check for me, Google what cardiac output means, what factors work on the cardiac output, why would the blood pressure affect cardiac output, what does viscosity has to do with the blood pressure, what does elasticity have to do, how do they tie all together to the blood pressure? What are the factors that influence blood pressure? What are some modifiable factors? And what are some non-modifiable factors? What does hypertension mean? What does hypotension mean? Are they the same? Are they different? What differs in them? And do we treat them the same? If we say they're both alteration in blood pressure, do we treat them the same? And then, so all these case studies I'm skipping, we're going to discuss them in class. So in the same route we've been doing, going through the nursing process, first is the assessment. We collect the data, we make sure we're using the adequate cuff pressure, and that our recording of the blood pressure is accurate, because we're gonna have to implement some actions and do major interventions on this patient. Is that blood pressure accurate? If it tells me it's too high, I'm going to give him blood pressure medication to reduce that blood pressure. Am I giving him the correct intervention for a correct blood pressure? Think of that. And then after I collect the data and I know what's my blood pressure, what am I going to come out with as nursing diagnosis? And then when I get the nursing diagnosis, what are some of my implementation? Again and again, I plan before I implement. And once I implement, I'm always gonna go back and check. Did that work? And whenever something doesn't work and it's related to blood pressure or pulse, you're not gonna wait for a day to change. You're going boom, boom, boom. These are vital signs. They get the word vital from them being vital with a capital VITAL. They're vital to the survival of your patient. So once when we're talking about assessment, nursing diagnosis, planning, implementation, evaluation, we're not talking hours. We're saying minute after minute. We do this, it doesn't work. We do this, we check it, it doesn't work. We check it, it works. We keep doing it. That's how we're doing. Continuous, instantaneous. We don't sit on abnormal vital signs, especially when it comes to vital signs that are directly related to perfusion and oxygenation. So your pulse, your respiration, your blood pressure, and your pulse oxygenation, these are vital, and if they're very abnormal, the patient is unstable, so you don't wait. Safety guidelines, some of the safety guidelines, you've been talking about infection control in the lab all the time. You've been wiping like crazy in between each other. Same concepts apply. You check your first patient's heart rate, pulse, you've assessed, you listen to those lungs, you are able to identify what lung sounds you're hearing, clear, adventitious, very good. You move on to your next patient. What do you do with COVID or without a COVID? You need to clean your stethoscope between both patients. You need to wash your hands. You need to know that this patient weighs 250 pounds. I used a large cuff on them. Can't use the same size for this patient who's 120 pounds. You have to be able to look at this. When they talk, analyze trends for vital signs. I check Layla's blood pressure, it's 110. I check Susie's blood pressure is 160. I'm looking at their previous vital signs. Okay, how does Layla sit usually with blood pressure? Okay, she always is in the 100, 105. So 110 is a very good blood pressure for her. Versus Susie, who was 190, and the previous nurse gave her a blood pressure medication to reduce her blood pressure. Now it's 160. I'm not very worried because that is a better reading than 190. Versus if her blood pressure was 110 and now it's 160, I'm gonna check. Is she anxious? Is she in pain? Is she due for her next blood pressure medication? So you need to always look at that. And the last one, determine patient status before delegating a vital sign scale. I want to discuss this in class. I want to hear your opinion before I divulge for you what is the appropriate answer for that.